one truly sick patient that I have come in contact with. You know what I mean? And right now, in general, I have friends throughout all the ICUs in San Diego, and in particular, the one I used to work at has 4 supposedly COVID patients, right? 4 right now in a bed of 13. So, and at one point in 2 months, I say maybe May or June, we were overwhelmed in the Chula Vista hospitals. And that was because we were accepting patients from Mexico. You know what I mean? So we have never been overwhelmed here in San Diego County at all in our ICUs, in the hospitals. I can speak to the fact that there's empty COVID tents. There's no patients in them being tested, and there's no patients at urgent cares being tested. So, I mean, they're tested once they go in, but the tents outside are empty. So where are these patients that we're saying we're overloaded and we have to lock back down because we're going to overwhelm the healthcare system? That's just not true. It's not true. I also want to speak to the fact that we are not in a COVID pandemic. We are in a PCR pandemic. That is basically verified by scientists across the world. You can look at the Great Barrington report if you want to go to that. I'll speak to that in a minute. But the government's been calling us to test, right? So, and then the cases keep going up. But the serious question that should be raised in the scientific community and those of us that are medical professionals that should be speaking forward is that the PCR testing that's being performed is not a diagnostic tool to determine an infectious process. It's not. It's not. It actually is not. The man who created Kerry Mullis, he died unfortunately right before the pandemic started, right? He clearly, repeatedly, before he died, said that his test should not be used as a diagnostic tool for a simple reason. It's incapable of diagnosing disease. So why are we using a test? That's basically a moot point. It's not being used to diagnose. The CDC actually said on July 13th that the detection of viral RNA may not indicate the presence of infectious virus or 2019 nCoV as a causative agent for clinical symptoms. It definitely said that. The performance of this test has not been established for monitoring treatment of the COVID-19 infection, and this test cannot rule out disease caused by other bacterial or viral pathogens. This test is bogus, in my opinion. And they're using it to say that the cases are going up, and that's why we need to lock down, correct? It's not. The other part of the PCR test that people need to understand is that they're using amplification cycles on it that are basically they're upping the amplification. What does that mean? That once the RNA is transcribed to DNA, right? It's such a small snippet that they have to run it through an amplification process. So 35 cycles is what should be a reliable. The World Health Organization, and many of them were using 45 cycles originally to do this test, which actually ups the positive case rates. It absolutely does. It's not reliable, and it should not be done. The other thing I want to stress to you that a positive test is not a case. Okay? So medically speaking, a case refers to a sick person. It never referred to someone who had no symptoms of illness, right? So essentially these asymptomatic cases. So a case, according to Lee Merritt, a case, the media and public health officials appear to purposely conflated cases or positive tests with actual illness. Correct?
Yes.
Yes. So she notes this is not epidemiology. This is fraud. It's absolutely fraud. You know this by the Stanford seroprevalence study, correct? If anyone followed that, that basically they decided that case fatality rate, which is basically those tested for disease, they present to care and they are diagnosed with the disease, and that's how many die out of the group, right? Then you have the infection case fatality rate, which is all the infections that exist in the world or in the country of the U.S. that are not being diagnosed, but that are not being tested. And what is the fatality of that group? And the Stanford study found that it was way higher in the infection rate than the case fatality rate. So this proves that there is rampant infection going on and not cases or actual deaths from the disease or from COVID, if you believe that, right? So what does this all mean for you guys? It means that we're being locked down, our freedoms are being stripped. Why? Why are they being stripped when there is little death, and like the gym owner said, that the death rate has flatlined. Why are we being locked down then?
Trump.
It's because of control. It is control, okay? And we are not going to take tyranny, right? I will agree, and I want to share a couple of personal stories, that there have been 2 personal stories close to me with kids 12 and 13. One committed suicide, the other tried. And so we cannot say, you cannot separate lives from livelihood. And you cannot separate the economy from public health and say that there is no downward spiral of all of this. That we cannot say that, like he said, the deaths are going to be so rampant if we stay locked down and we keep people isolated. There are extroverts that need to be out. There are kids that need to be at school. And there are definitely people that need to live their lives.
That's right.
And my other one is that the mask. First and foremost, the mask, right? So, right, a muzzle. Thank you, a muzzle. Yeah. So basically.